Welcome to my public service announcement regarding a mental health screening tool that can be used by school nurses in schools. To begin, let's talk about some common mental health challenges, issues, and concerns amongst school-aged children. It is estimated that between 10 to 20% of children and adolescents have a mental, emotional, or behavioral disorder that meets diagnostic criteria. Unfortunately, stigma surrounding mental health often leads to delay in treatment, which can then in turn lead to harmful consequences for the child. Common mental health disorders in children include anxiety, depression, and ADHD. The COVID-19 pandemic had a large effect on school-aged children. The closure of schools during the pandemic led to a sudden increase in social isolation, loss of daily structure, and increased fear of the unknown, which all contribute to increases in anxiety and depression. Anxiety in particular can affect school performance, especially in children who come from underserved backgrounds. It can also lead to changes in how children interact with their peers and their environment, and can negatively affect a child's sense of school connectedness, which is the sense of belonging, safety, and fairness in school. School nurses identify when a student requires a higher level of care and can make recommendations and referrals. This is not limited to physical health, but also extends to mental health. School nurses can educate teachers on signs and symptoms to be aware of in their students. These signs can include difficulty concentrating, changes in appetite, frequent or constant worrying, irritability, crying, or outbursts, and often complaining of tummy aches or the general feeling of being unwell. School nurses rely on evidence-based screening tools when screening for mental health disorders in children, such as anxiety. An excellent tool is the Revised Child Anxiety and Depression Scale, or RCADS. It is a 47-item questionnaire that screens for different types of anxiety and depression, and it is used for children between the ages of 8 and 18. However, a 47-item questionnaire may be too long for a student to complete during a visit to the school nurse. Therefore, the RCADS offers smaller, shorter subset questionnaires that focus on different types of anxiety or depression. The student rates how often they feel or experience a certain item on the questionnaire from never, sometimes, often, or always. Each answer is assigned a score of 0, 1, 2, or 3, respectively. The RCADS includes a user-friendly scoring system that the nurse may use to determine if the student is experiencing anxiety or depression and if a referral should be made. This scoring example demonstrates that a student has demonstrated signs of generalized anxiety and therefore a referral to higher level of care should be made. Giving a student a paper questionnaire in the school nurse office may feel like a test. Instead, the school nurse can choose to turn the questionnaire into an interactive question wheel. This interactive form makes the questionnaire much more captivating and a lot less daunting. The nurse can assist the student with moving through the questions on the wheel and record the answers on behalf of the student. By doing so, this allows the student more freedom to think about the question and how they feel about it, rather than focusing on recording their answer on the paper, which may make them feel as though they need to get the right answer, even though there is no right answer for these questions. The RCADS is an efficient and straightforward tool that assists school nurses in their clinical decision-making and allows them to identify students who require further evaluation or treatment for anxiety or depression.